Let's take a look, okay?
75-year-old Sonia Santos is a force of nature, working in Manhattan full-time 10 years after retirement age.
I never felt any pain until one day going home, using my commute in the subway in New York, I stood up and I felt a snap on my right knee.
Sonia had severe osteoarthritis. Less than 1 year after doctors replaced her right knee using traditional knee surgery, orthopedic surgeon Yair Kissen recruited Sonia for a clinical trial, testing a cutting-edge new method to replace her left.
We're actually able to personalize the surgery.
It's called T-Solution One Total Knee Application by Think Surgical. A 3D planning station lets surgeons map out a detailed plan before surgery. Then the doctor uses a robotic bone-cutting tool for maximum precision during the procedure.
Essentially, we have a little control lever with an on-off button, and the device is cutting before our very eyes what we would normally do with a saw and directly with our hand on the cutting device.
They are very comfortable.
Santos gave up high heels for blinged-out sneakers. She says both knees feel good, but
The left knee is like my natural knee. I don't feel anything.
I'm Marty Salt reporting.